Hey guys, as you know, last week I was totally geeking out about End Tidal CO2 monitoring for patients on med-surg floors or on lower acuity floors, and I want to kind of explain to you now why. So first of all, End Tidal CO2 is essentially like another vital sign that we can be checking on our patients to really check for respiratory depression or any form of respiratory distress, which I think is amazing. And I'm not really quite so sure as to why we weren't doing this before, other than we probably didn't have all of the resources available to be monitoring this for every patient that needed it. So let's talk a little bit about the details of what I learned. So I learned that for somebody that's opioid naive or somebody that's on opioids needs this type of monitoring if they have other risk factors like sleep apnea, or if they're obese. Their age can matter in this, and so can their gender. And we're going to talk about the stop bang score in just a little bit in this video so that you can actually see how you can determine whether or not somebody needs this continuous monitoring. So almost all of my patients have sleep apnea, and I think that's really cool that we now have this study and this evidence-based practice that tells us, like, if somebody has sleep apnea and they have all these other things going on with them and they also get an opioid, they are at a higher risk for having respiratory depression. And our End Tidal CO2 is going to tell us when that's happening 4 minutes before any other vital sign, which is really incredible. So 4 minutes before their oxygen saturation starts to change, or their blood pressure, or their heart rate, 4 minutes before that, you can check their End Tidal CO2 and be alerted if there's any changes. That means that you could be able to push life-saving medications like Narcan faster. You could start a rapid response quicker. You might even be able to start CPR quicker if you know that these things are going on. Now, this is something that really pertains mostly to night shift, which is why I'm so excited, because I work the night shift, or for when your patients are asleep during the day. But day shift isn't going to see this as much as night shift nurses are going to, because respiratory depression a lot of times takes place when people are asleep. So you've probably already seen this End Tidal CO2 being done during CPR or during intubation. So if you work on a unit that's ICU or NICU, PICU, PEDS units, you might already see this pretty regularly. Every patient that is intubated should have something monitoring, and usually respiratory therapy takes care of this, but monitoring their End Tidal CO2. Then End Tidal CO2 lets you know if the tube got dislodged or if that person is ventilating properly. So it's also a good indicator when they first put it in. It's a gold standard to tell us whether or not that tube is in the accurate placement. During CPR, you can determine whether or not your chest compressions are deep enough, fast enough, or if they're too fast, based on their End Tidal CO2. So the End Tidal CO2 during compressions should be between 10 and 20 millimeters of mercury. That's how it's measured during CPR. So what's really cool is your leader during the code should be able to tell you, hey, you're fatigued, you need to switch out, based on that number that they can see. So you're not just doing CPR for the fun of doing CPR, you're doing it so that you can actually be effective in helping a patient. Normal End Tidal CO2 for a patient that is breathing just fine is between 35 and 45 millimeters of mercury. If a patient's a little bit higher than that, that's okay. A lot of times COPD patients are going to have a range between 45 and 50, and you just need to learn what your patient's normal is. And most machines that you're going to hook somebody up to, they do help you determine what the baseline is for that patient so that you can set parameters for when you will get alerted based off of the norm for that patient. I have recently had 2 code situations or rapid response situations where if I had known the End Tidal CO2 sooner, if I had been alerted a little bit sooner, something could have been done for that patient quicker. I am so excited that this is rolling out on hospitals all throughout the US and on units like mine where they don't necessarily need it all the time, but they might need it in certain cases. Patients might need it if they're on opioids for the first time or if they have newly diagnosed sleep apnea. And there's all different things that will tell you whether or not a patient actually needs this End Tidal CO2 monitoring while they are asleep. So go ahead and check out the stop bang score that I'm going to talk about next. Okay, so let's talk about this stop bang score or this stop bang screening method. You may see it in your charting system as a sleep apnea screening tool or an End Tidal CO2 screening tool. It just depends on what your charting system looks like and what is available to you. But the information is exactly the same. So let's talk a little bit about what it is and what it means for your patient and how you can use it as a nurse on the unit. Now, you can use this screening tool anytime a patient comes onto your unit, either for an admission, a transfer, post-surgery, or anytime that they're prescribed an opioid that they aren't normally on, or even that they are on long-term. So here is what stop bang actually means. You're going to assess for these things. Do they snore loudly when they sleep? And some of these questions are things that you can ask the patient directly, or you can ask a family member if the patient can't answer you at that time. So S is for snore loudly, T is for tired or fatigued during the day when they're doing things. This could mean that they're not getting good sleep at night, which could mean they may have sleep apnea. Observed breathing while asleep. So this might be something that you observe while they rest during the day or while they're asleep overnight. Do they stop breathing when they're sleeping? Do they get short of breath while they're sleeping? These are things that you can see. Their pressures, so do they have hypertension or not? Their BMI, is it greater than 35? An age of 50 or older? A neck circumference over 40 centimeters. This is something that you can measure, but it's also something that you can visualize pretty easily as a nurse, especially once you get a little bit of experience. So I would say measure a couple of times if you have access to a measuring tape, and from there you can kind of gauge this for yourself. And then gender. Your male gender increases the risk for a sleep apnea issue or an issue with an opioid. So knowing this stop bang score and how to do this stop bang score is what's really important. Now, for each question they answer yes to, they get 1 point. If the patient scores a 6 or above and is prescribed an opioid, then they need continued ETCO2 monitoring while they are asleep. This is really important for day shifters and night shifters to understand. If your patient is up and walking around, they don't need End Tidal CO2 monitoring because chances are they're probably just fine. They're talking, they're engaging. Your End Tidal CO2 starts to go up and you start to have a lot of issues during rest, which is why this is so important for a night shifter to understand the mechanism of this and how it actually works. Because a lot of times those RRTs and those code situations do happen when a patient is at rest or is asleep, and those systems start to slow down a little bit. So this is what the stop bang screening tool actually looks like, and this is something that you're probably going to be seeing in your hospital very soon if you don't already. Okay, so I don't know about you guys, but I am so excited for this and so pumped because this just means that we can learn even more about our patients and know whether or not they are safe while they are sleeping throughout the night, especially those high-risk patients. So if you're somebody that already uses this type of monitoring, I would love to hear your input. Go ahead and comment below, and the first 5 people that comment below with their input about the monitoring of CO2 on their unit and some details about that will be receiving a small little gift from me, and I can't wait to send it to you guys. All right, thank you so much for watching, and I hope you learned just as much as I did. Bye, guys.